This film has the power to change your life if you are over 60. Your generation has had many highs and lows. However, there is one obstacle that no one can really prepare you for: how to prevent strokes in your brain as you age. As a neurologist, I have witnessed far too many healthy individuals abruptly lose their speech, walking, or even the capacity to identify their loved ones. And frequently it's due to 7 seemingly innocuous morning routines. One important lesson I've learned in my 15 years of practice is that a stroke isn't just a chance accident. It is the outcome of the little decisions we make each day, particularly in the crucial first few hours after waking up. I'll go over these 7 habits with you today, starting with the least harmful. Every one of them has scientific support and offers easy-to-implement remedies that you can begin utilizing right away. Let's start with habit number 7, which is excessive coffee consumption when not eating. Coffee is a common way for older individuals to feel alert and get over their grogginess, but taking too much of it shortly after getting up, especially before eating anything, can be detrimental. Coffee narrows blood vessels, elevates heart rate, and boosts adrenaline. Blood pressure quickly rises as a result of this abrupt effect, which may also lessen blood supply to the brain. According to a 2011 study, because caffeine is absorbed more quickly, the risk of ischemic stroke increased an hour after drinking coffee, especially when it was consumed on an empty stomach. For those with high blood pressure, this sudden caffeine surge could trigger a mini stroke or even irregular heart rhythms. Drinking multiple cups back to back makes the risk even higher. You may feel more awake, but inside, your brain is working under stress it doesn't need. A healthier approach is to start your day with a glass of water. Have a light breakfast first, then enjoy 1 moderate cup of coffee. Try not to load it with sugar or heavy cream, as both contribute to inflammation and damage the inner lining of your blood vessels over time. Now let's look at habit number 6, ignoring morning dizziness or muscle weakness. Feeling dizzy, unsteady, or weak first thing in the morning is not something to dismiss. Many older adults chalk it up to aging or a poor night's sleep, but these may actually be early warning signs from your brain. They could point to reduced circulation, high blood pressure, or even a transient ischemic attack, also called a mini stroke. Dizziness can mean your brain isn't receiving enough oxygen. If your arm feels weak, your speech sounds slightly unusual, or your face feels a little numb or slack, even if it passes quickly, you should not ignore it. These subtle symptoms can be your body's way of warning you that a major stroke may be on the horizon. TIAs often happen in the early morning hours and may last just minutes, but they are critical red flags. The American Stroke Association encourages the use of the acronym FAST, face, arms, speech, time, to remember the early signs. If something feels off when you wake up, write it down. Call your doctor and keep track of any patterns. Your body whispers before it screams. Listen carefully. The 5th habit is getting out of bed too soon. A good night's sleep puts your body in a relaxed, low-pressure state. Your brain hasn't completely adapted to an upright posture, and blood flow slows down while you sleep. The Mayo Clinic identifies orthostatic hypotension, a sharp drop in blood pressure when standing, as a stroke risk factor, which can be brought on by abruptly jumping out of bed. In addition to causing dizziness, fainting, or falls, this disorder may also limit blood supply to the brain in older persons. If your arteries are already restricted or stiff, it can make you more susceptible to a mini stroke or perhaps a major stroke. A better habit is to remain in bed for a minute or two after waking. Breathe slowly, stretch gently, sit up gradually, then stand. These extra 2 minutes allow your body to adapt smoothly, improving circulation and reducing strain on your heart and brain. It may seem simple, but this transition can have a major impact on your morning stability and brain health. Before we dive into the 4 most dangerous habits, I'd love to hear where you're watching from. Drop your city in the comments below. I'm always inspired to see where this message is reaching people around the world. The 4th behavior we'll discuss is retaining your urine for too long after waking up. Delaying your morning restroom break may seem innocuous, but it can subtly strain your cardiovascular system. Your bladder gets too full when you retain your urine after waking up. Your body receives a stress signal from that, which causes hormones like cortisol and adrenaline to be released. According to a 2000 study, A full bladder can narrow your coronary arteries and lower blood flow, particularly in people who have early-stage atherosclerosis or artery hardening. These stress hormones raise your blood pressure and tighten your blood vessels. This creates a dangerous situation, especially in older adults with high blood pressure or existing artery stiffness. The solution is simple but powerful. Get out of bed and use the bathroom as soon as you feel the urge. Don't scroll your phone first. Don't lie in bed just a little longer. The longer you wait, the more pressure your body's under, and that adds unnecessary risk. When your body tells you something, it's not being inconvenient, it's being wise. Learn to respond, not ignore. Habit number 3 is skipping morning water. Your brain is made up of about 75% water. After 7 or 8 hours of sleep with no fluid intake, your body and brain wake up dehydrated. This makes your blood thicker, increases your blood pressure, and forces your heart to work harder to push blood to your brain. All of this can sharply increase your stroke risk. This habit is incredibly common among older adults, and the damage often goes unnoticed. A 2015 study found that dehydrated stroke patients were nearly 4 times more likely to have poor outcomes compared to those who were hydrated. This is especially serious if you take diuretic medications, which cause even more fluid loss. Instead of reaching for coffee or tea first, drink a large glass of room temperature water when you wake up. This simple habit thins your blood, improves circulation, and helps your body reset. Even if you're not thirsty, your brain is asking for water. Give it what it needs. Now let's go to habit number 2, eating a high-salt breakfast. Many older adults think they're making healthy choices, but breakfast often includes processed foods that are secretly packed with sodium. Cereals, instant oatmeal, cheese-filled eggs, sausages, and store-bought bread may contain much more salt than you realize. Excess salt raises your blood pressure, stiffens your arteries, and puts immense pressure on the delicate blood vessels in your brain. That pressure can rupture weaker vessels, causing a stroke. A 2012 study found that people who consumed over 4,000 milligrams of sodium per day had a stroke risk more than 2.5 times greater than those who kept it under 1,500 milligrams. And for every 500 milligram increase, stroke risk rose by 17%. Mornings are already a time when your blood pressure naturally rises. If you add a salty breakfast on top of that, you're adding fuel to a dangerous fire. Choose breakfast foods with low or no added salt, like fresh fruit, boiled eggs, unsalted oatmeal, or whole grain toast with a small amount of butter. Read nutrition labels carefully. Many foods labeled heart healthy are still high in sodium. Aim to keep your total breakfast sodium under 400 milligrams to give your brain a better start to the day. Finally, the most dangerous habit, skipping or misusing your morning medications. Every day, millions of older adults either forget to take their pills or take them at the wrong time. This one mistake can drastically raise your stroke risk in a matter of hours. That's because medications for blood pressure, cholesterol, and blood thinning all work best when taken at the same time daily. When you skip a dose or take it late, your body loses the protective rhythm it depends on, especially during the morning blood pressure surge. A 2023 study showed that people who didn't take their blood pressure or atrial fibrillation medications on schedule face significantly higher stroke risks. Some people even try to make up for missed doses by doubling up, which can cause dangerous side effects like internal bleeding or extremely low blood pressure. Others swallow their pills dry or with coffee, which prevents the medicine from absorbing properly. These small mistakes have big consequences. Establish a reliable morning schedule for taking your meds. Put a reminder on your phone. Make use of a weekly medication planner. Additionally, always do as your doctor directs. Even if you feel fine, you should never change your medicine on your own. Seek assistance from your physician or pharmacist if you're feeling overwhelmed or confused. They can help you make sense of your routine and make it easier to follow. Consider your drugs to be your brain's protectors. Don't begin your day without providing your brain with the necessary support, just as you wouldn't leave your house without locking the door. As we've seen, strokes don't usually come out of nowhere. They build quietly over time through daily habits and unnoticed warning signs, especially in the early morning hours. Now that you know the 7 habits that can quietly raise your stroke risk, the power is in your hands. Which of these habits do you recognize in your own morning routine? Have you made changes that improved your brain health? Share your thoughts in the comments below. I believe that health isn't about luck. It's about the small choices we make consistently. Your mornings matter. They shape your day and your future. If this video helped you learn something important, please like, share, and subscribe to Golden Vitality, your trusted source for practical medical insights and better health after 50. Watch our next video on stroke prevention linked in the description, and we'll see you in the next episode of Golden Vitality.